Hello everyone, welcome to Pediatrics by Dr. Anand. This is the Unacademy NEET PG platform, and let me know if my voice is audible to everyone. Yes or no? We have to start the session. Today is a very beautiful topic, and I have prepared very well. The question is, are you ready? That's the question. So, if my voice is audible to everyone, let me know. Please put a message in the comment section. I hope my voice is audible to everyone. I also have to cross check whether my voice, it's audible to me. Is it audible to you? That's the question. Okay. Yes. Is it coming? Yes or no? Yes or no? Yes or no? हाँ जी, I think मेरे को आ रही है आवाज. Beautiful. Let's start. Let's start the beautiful topic. हाँ जी. Many of the students, they are asking me the link. I'm sharing the link with you. 1 second, bro. Let me share the link and we're gonna start the class. Many of us are asking the link. Okay, nice. Okay, good. I think we have to start the class now. It's a proper topic I have made like with a very beautiful this thing with a full conceptualized manner. So put your best intention to learn in this class and let's rock the stage. Anji, chalo, let's start. Hello everyone, welcome to Pediatrics by Dr. Anand. Where is my pen? My pen is here. Hello Osama, hello Shubhangi Kaushik. This is the Unacademy NEET PG platform. My name is Dr. Anand. I'm MD Pediatrics. I've done my SRship from Lady Harding Medical College, Hindurao Medical College. In this topic, we're going to talk about Wilson disease. First of all, Feb 26th, please, are you free? Let's go out. Let's go out. Let's go out to where? Let's go out to give this test. Feb 26th, please spare yourself some time. 9 a.m. we have a NEET PG 2022 All India mock test. So spare time for that. And also we have in beautifully, this is one of my favorite, we are introducing notes for the what you call the NEET PG and the duration 19 books, all subject wise notes, free with 1 year plus subscription. Now this is a new thing and that's what every one of us always desire to have notes. So this is the duration of the plan you can take, this is the price, and this is the final price after using some code. You can use this code Dr. Anand. It will be little helpful for you financially if you're planning to buy some pack, because the price is hiking very soon. Also at the same time in Unacademy we have plus subscription, where most importantly you get to access all the live and recorded classes. Educators are top class over here. You can watch on your Android, on your iPhone, on any device. We have something known as iconic subscription. In the iconic subscription, you have the Unacademy platform and the Prep Ladder subscription. Everything, live batches, question bank, live test quizzes, everything is an iconic subscription. Okay, it's an iconic. Also, congratulations to someone. रात को ना घर पे खाना बनता है और बस मेरा गला ऐसे से होना शुरू होता है. And again, congratulations to our amazing, toppers of FMG batch who have worked so hard in learning and getting the best rank possible. And I'm so proud of them. And now it's your turn to rock the stage. Okay. Also, at the same time, we have this beautiful test series. I recommend to give, you should give. We have surgery test series, we have biochemistry test series, we have all India mock test. Make a schedule, finish all the MCQs possible. मैं तो यही बोलूँगा. And most importantly, if you are a newcomer, please download Unacademy and get the access to beautiful interactive live classes. And we make nice MCQs poll, and you ask me any doubt anytime, and all the lectures are in PDF format. And what else? Yeah, NEET PG 2022 previous year questions batch. Yes, this is important. Can we appreciate this? Last 3 year questions are everything. So for 2 months we are starting that batch. I hope you are a part of it. मेरी भी photo है इसके अंदर, ये छोटी वाली, ठीक है? Nice. Next, very importantly, we have a FMG batch, also very important, where everyone is being a good part and helping all the students. And also we have the FMG 2022 comprehensive batch. And next तो आ ही गया है. Next में तो everyone has to be like rapid revision we have to do. That's what. And yes, NEET PG 2022 all educators revision batch. From 2nd March, basically for 2 months, we are starting in a well-defined structure, revision classes, self-study, test, and solution discussion. I think it's amazing. Okay, let's start. Let's start the amazing topic. And today's topic of choice is nothing but Wilson disease. Okay. Now this topic has to be in proper speed, because my intention is to finish this topic in a very proper way in today in one class only, but you have to participate with me, okay, because I have made the topic in a very conceptualized manner. And if number one, if you are a newcomer, then of course most welcome, start making notes. And if you are here just to look at my face and enjoy life, and to revise also, then answer. Because if you answer, हो जाएगा दूध का दूध और पानी का पानी. How much do you remember? Okay, before starting any amazing mind-blowing segment, we have a beautiful quote. The motivating quote for today's evening, ladies and gentlemen, is: the struggle you are in, The struggle you are in today is developing the strength you need for tomorrow. The struggle you are in for today, the pain, the struggle, the hard work, the sleepless nights, the stress, the tension, the crazy thing of getting a seat or having a wonderful future and having a wonderful life. So much of struggle, our mind, our body, physically, mentally, emotionally, on every level we are having struggle. But what is the use of this struggle? Yes, there is some use. The struggle you are in for today is developing the strength you need for tomorrow. ठीक है? No pain, no gain. My gym fellow says no pain, no gain. ठीक है? And my in my dance classes it is written करने से होगा. बड़ा बड़ा लिखा होता है, बड़ा बड़ा. करने से होगा. सर कैसे होगा? सर हाउ विल आई पास? करने से होगा. सो हाउ विल आई रिमेंबर? करने से होगा. सर हाउ विल आई रिवाइज? करने से होगा. सर हाउ विल आई डू 5 times रिविजन? करने से होगा. सर हाउ विल आई गेट अ रैंक 1? करने से होगा, करने से होगा. करो और होगा. दैट्स इट. ठीक है. Then Ganja, Dr. Ganja is saying always appreciate your barber, and I never understand why he says that, but it's good to say. Hello Ibza, hello everyone, hello Priya, Julie, Ibza, Shubhangi, Osama, and beautiful Sachidanand Yadav. Let's start. The topic of choice is Wilson, but ऐसे नहीं पकड़ेंगे हम. टॉपिक को पकड़ेंगे ऐसे 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 टेढ़ी उंगली से पकड़ेंगे. हाँ जी, कैसे पकड़ोगे सर? What are you trying to say? Yes, yes, Osama buddy. Thank you for this quote. I would like to thank Dr. Osama Sheikh. He helped me in finding this quote. Actually, but you know the problem. What happens? Making the lecture is not a problem for me. Making the lecture is not a problem. Finding the ideal quote is the problem. Like you won't believe today also. Like I came 3 minutes late to the class because from last 15-20 minutes I was searching the motivating quote. Whole Google I have finished. Whole Mahabharata course, Ramayana course are over. I'm like searching for the good quote takes more time than finding the lecture. Imagine what next platform we are landing up into. That's what, right? So let's start the motivating quote. So let's start the topic, dear. Let's talk. Let's talk. Let's talk about it. It's an oral test. Imagine we are sitting. I am the examiner. You are the student. Hanji, tell me some white matter disease. So remember, we have two type of disease. We have gray matter disease and we have the white matter disease. Have you heard of gray matter and white matter? Who will tell me? Gunjan Singh. Gunjan Singh, white matter. So white matter, is it inside the brain or the periphery one? Which one is the gray matter? Which one is the white matter? If this is my brain, or this is my cut section of the brain basically. So which one will be the white matter and which one will be the gray matter? Anyone? Is this the gray matter or is this the gray matter? What do you think? Anyone? Yes. So yes, remember dear, this one is the gray matter, this one is the white matter. Okay, मोती की तरह पढ़ेंगे टॉपिक को. Yeah, exactly, Osama is right. Gray is outside and white is inside. Okay, white is pure, purity is inside me. So inside is the white matter, outside is the gray matter. We have to talk fast, answer back to back, have a very fresh and a very good vibe for this topic and finish it off. Okay, and it's a very very conceptualized manner I have made, so you have to answer it. Okay, exactly. In my case, white is outside, okay. But imagine white is inside, gray is outside. That's how I remember it. White is inside my soul. So white अंदर वाला part होता है, gray बाहर वाला part होता है. Can anyone help me? Can anyone help me? Examples of white matter disease. Anyone? Dr. Ganja, Osama, Shubhangi, Sachinanand, and Umesh Vishwakarma. Name some white matter. Name 4 examples. Just 4 examples of white matter disease and 4 examples of gray matter disease. Very simple, but yet very important question for super specialty exams, even for MBBS paper also. बच्चा ये question छोड़ के आता है ऐसे ही. White matter disease, I've never heard about it. I don't know what is he asking. So anyone? Exactly. Beautiful. Oh, people are answering. Nice. Gunjan says life is grey. Cute. Have you seen Grey's Anatomy? Is nice. Okay, we have white matter disease. The examples of white matter disease are white matter. Okay, this one, white matter. The examples of white matter disease are number 1, Krabbe's disease, Krabbe disease, Alexander disease, Canavan disease, and metachromatic leukodystrophy. Let's learn and revise, please, my dear friends. Osama, यहीं बोल बोल के पढ़ खत्म कर भाई, ठीक है? So anyone, Julie, finish it off. So we have Krabbe disease, Alexander disease, Canavan disease, and metachromatic leukodystrophy. Okay, Krabbe's, Alexander, Canavan, and metachromatic leukodystrophy. ठीक है? KACM. ठीक है? Finish. What is this? So this one you're talking about the what you call white matter, अंदर वाला white matter disease. Krabbe's, Alexander, Canavan, and metachromatic leukodystrophy. Yes, yes, right. Hanji, I have seen 50 Shades of Grey. I think everyone would have seen 50 Shades of Grey. Next one, what are gray matter disease? Anyone? One example, Osama, answer though. Julie, Shubhangi, so many people are there. Ibza, tell me some gray matter disease. White matter disease is over, okay? Canavan, Alexander, sorry, Krabbe's, Alexander, Canavan, and metachromatic leukodystrophy. Finish here only, revise, bolo, bol ke pado, bolo. Say Krabbe's, say Alexander, Canavan, and metachromatic leukodystrophy, KACM. Finish. Okay, ये क्या है ये? White matter. What about the gray matter? Anyone gray matter? Okay, very good, Osama. So, gray matter disease, number one, gray matter, right? Gray matter. Is Wilson disease a topic of choice? Hai Wilson, right? Is Wilson disease, okay, I'm the examiner. I'm the examiner, you are the student. Okay, so Dr. Osama, okay. Which year? Final year? Final year. Okay, fine. So, Dr. Osama, gray matter disease. Is Wilson, doctor, tell me, is Wilson disease a gray matter disease or a white matter disease? What do you think? Anyone, what do you think? Is this a gray matter or a white matter? The examples of gray matter disease are number one, Menkes disease, our Wilson disease, the topic of choice, League syndrome, and Tay-Sachs disease. Very beautiful. See, ऐसे होती तो बहुत सारी हैं. There are a lot of disease of gray matter and white matter. At least I want you to remember this much at least. Okay, this much, because बूंद से सागर बनता है, बूंद से सागर बनता है, तो बूंद बूंद याद रखेंगे तो सागर अपने आप बन जाएगा. So please, can we appreciate yes or no? Gray matter disease. What are the examples? Number one, Menkes disease. So easy है ना, Wilson disease पढ़ रहे हैं हम आज. Menkes disease, Wilson disease, League syndrome, and Tay-Sachs disease. याद रहेगा या नहीं रहेगा? Yes, exactly. Yeah, you can say that, but mostly Wilson, like the book say, Nelson says Wilson disease is one of the gray matter disease. Okay, majority cases we see that. Okay, Ibza. So that's what finish. Now coming to the topic per se, our Wilson disease. Okay, Wilson. ठीक है, simple, very beautifully. I want to finish this topic. Okay, Wilson disease. Question number one, Wilson disease, right? Wilson. This is my face. Nice, no? This is nice face. This is Q2 baby, Q2 baby, Q2 baby. This is my first patient. This is my first child patient I had in my first year of MD Pediatrics. और तब से I had this dream of teaching that this picture I will always put, and see, this picture is always there, always, and it's like a brand. I have a copyright on this picture. I have a trademark on this picture because my face only is there in this picture. That's why. Okay, that's what. So Wilson disease. Question number one. So Dr. Hriday Trivedi, प्यारा नाम है, मोती जैसा आपका नाम है, हृदय उमेश. हाँ जी. What is the other name? Please, it's an oral test. हाँ जी बोलो. Wilson disease is the MBBS topic. Okay, so we have to discuss it now. हो गया revision. What is the other name? हाँ जी डॉक्टर साहब. What is the other name of Wilson disease? Anyone? What is the other name? Answer to the point. What is the other name of Wilson disease? Anyone? Hepato. लिवर का प्रॉब्लम है ना, लिवर में प्रॉब्लम होता है, विल्सन में होता है ना, लिवर, कॉपर एवरीवेयर, कॉपर एवरीवेयर. द अदर नेम ऑफ विल्सन इज हिपैटोलेंटिकुलर डीजनरेशन. प्लीज राइट द अदर नेम of Wilson. Hepato means liver. Hepatolenticular means inside the cell. So hepatolenticular degeneration. Hepatolenticular degeneration is the other name of Wilson disease. Can we revise? Yes or no? Shagufta, Priya. Okay. So the answer to the point. What is the other name of Wilson disease? Hepatolenticular degeneration. Is Wilson a gray matter or a white matter? Sir, Wilson is a gray matter. Name some other gray matter disease. See, अगर Wilson paper में आ गए, if you're an MBBS student and Wilson disease is your MBBS question, if you start writing like this, white matter disease and gray matter. In white matter, these are the examples. In gray matter, you have Menkes, Wilson, Leagues, and Tay-Sachs. Full number you'll get in exam. That's how the presentation works. Okay, exactly. Gunjan says, sir, please teach other subjects also. Achha, aajo. Gynae pade? Gynae. You want to study gynae? Preeclampsia will study. Gravida para, you want definitions, want surgery, you want surgery. First finish this disease, then we'll talk about other subjects also. So Wilson, the other name of Wilson disease is hepatolenticular degeneration. Number one. Number two, Hanji, the Wilson we're gonna cover in these topics: introduction, incidence, sex ratio, pathogenesis, clinical feature, diagnosis, treatment, and prognosis. That's how any topic should be beautifully covered. Okay, Wilson, let's start the first thing. Wilson disease. See, Wilson disease patient. like everyone knows, like in general, Wilson disease में क्या होता है? Copper. There is a problem with the copper. If I'm teaching to a 7th class student, imagine you are a 7th class student and I am a 10th class student. Okay, so 10th class students teaching to a 7th class student. So you know, bro, what happens in Wilson? Copper. You know copper. Have you heard of copper? Copper is everywhere. Okay, copper is everywhere. There is a copper deposition in my eyes. There is a copper deposition in my liver. There is a copper going in my urine. So there is serum copper, hepatic copper, copper content in eyes. Everywhere it is copper. And when there is too much of copper, bro, in the liver, no, it causes chronic liver disease. So one of the important causes of chronic liver problem, chronic liver disease, is nothing but our Wilson disease, right? Now I would like to know, Dr. Julie, can you name? See, we have to link and study. Okay, so copper. Every time I say you sit inside the topic, now you are inside the Wilson. You are the god of Wilson. Okay, now copper. Okay, copper in my eyes. Finish. Copper liver, like copper is in my liver. Hepatic copper increases. Copper is in my blood. Okay, serum copper increases. Copper is in my urine. Urinary copper increases. Everything increases because I am the copper, and copper everywhere. Are you understanding? So when copper everywhere and copper is in my liver causing chronic liver disease or hepatic copper increases, can anyone tell me any other causes of chronic liver disease? Anyone? Chronic liver disease itself is a 5 marks question. What are the causes of apart from Wilson? Do we have any other cause of chronic liver problem? Anyone? Please use your brains. ऐसे scratch करो. कईयों का घुटनों में दिमाग होता है. Please scratch your knee joint. If you scratch your knee joint, little some brain will, some viper will increase. हाँ जी, Osama Sheikh, very good. So viral hepatitis or any hepatitis also can cause chronic liver disease. Very good. What else? Okay, Osama says HIV. The Sachidaran says hematochromatosis. So the causes of chronic liver disease are divided into, yes, viral hepatitis, autoimmune liver disease, metabolic causes, venous obstruction, and biliary obstruction. The liver, right? Liver, bro, you know that, right? So you have this common, right hepatic duct, left hepatic duct, and common hepatic duct. So all that biliary tract, all those venous problems, right? So again, please, can we connect? So the causes of chronic liver disease are, number one, viral hepatitis. Which viral hepatitis, sir? Hepatitis B and hepatitis C. See, one more thing, I don't want you to cram. Okay, don't cram. In general, like, are you understanding that concept, right? Wilson disease, there is a chronic liver disease problem. Chronic liver issues I will have, number one, if I have a viral hepatitis. Example, I have a hepatitis B, hepatitis C infection, right? Second cause, I will have a chronic liver disease. The cause is autoimmune liver disease. Can anyone tell me any one example of autoimmune liver disease? Any examples of that? Very good. Umesh is already answering. We have autoimmune hepatitis and autoimmune cholangitis. Everything, imagine liver, this right hepatic duct, left hepatic duct, common hepatic duct, bile duct, cystic duct, and cystic duct, and then bile duct. Bile duct enters the second part of duodenum, right? The whole biliary tract is the problem there. So number one, the causes of chronic liver disease. Actually, headings you should know. Okay, examiner ask you headings wise, sir, viral hepatitis, sir, hepatitis B, hepatitis C, patient can have chronic liver disease. Sir, autoimmune liver disease like autoimmune hepatitis, autoimmune cholangitis, the patient can have. Metabolic causes. Anyone? Metabolic. Can anyone tell me one example of metabolic causes of this chronic liver disease? Dimag लगाओ, metabolites. What are the metabolites? Anyone? Umesh, Hriday. See, we have to study in a conceptualized manner. Okay, it's not just cramming Wilson 10 points topic over. No, could be a next topic, could be a theory topic, could be a clinical topic. Anyone? Yes, very good. The metabolic causes of chronic liver disease are, number one, Wilson disease, of course, the copper problem, glycogen storage diseases. Yes or no? Some metabolism का problem होता है ना? Disorders of carbohydrate metabolism, disorders of amino acid metabolism, and in disorder of the carbohydrate metabolism, we have the glycogen storage disease, right? We're gonna cover inborn errors of metabolism, and this is one part of it, right? So again, remember, the metabolic causes of chronic liver disease are Wilson, GSD, glycogen storage disease, and progressive intrahepatic cholestasis. I don't want you to cram. Don't cram, okay? Don't cram. I रटो मत एक लाइन को. एक थोड़ा सा आइडिया होना चाहिए. Okay, metabolic causes are like these all. Viral means viral, hepatitis B, hepatitis C. Autoimmune means autoimmune hepatitis, autoimmune cholangitis. The whole problem is in the biliary tract only. Venous obstruction, can anyone tell me any venous obstruction problem can lead to chronic liver issue, chronic liver disease? Have you heard of portal hypertension or anything? Yes, very good. Budd-Chiari syndrome, any veno-occlusive disease or constrictive pericarditis. So in general, Budd-Chiari syndrome and any occlusion, veno-occlusive diseases and Budd-Chiari syndrome is the venous obstruction problem causing chronic liver disease. And last but not the least, biliary, pura biliary tract, biliary atresia, choledochal cyst, or any primary sclerosing cholangitis. So these all are the causes of chronic liver disease. And today's topic of choice एक छोटा सा अंश उसके अंदर, that is Wilson disease. समझ के पढ़ें प्लीज, ये बहुत इंपॉर्टेंट स्लाइड है. ऐसी हवा में लग रहा होगा लेकिन ये बहुत इंपॉर्टेंट स्लाइड है. You have to think 10 things and choose one out of it and talk about it. So very beautifully, we have started gray matter disease and white matter disease. In those diseases, we have started a disease called Wilson disease. Wilson disease, one of the causes of chronic liver disease. Wilson disease means there's a chronic liver problem. Then we have other causes of chronic liver disease like viral hepatitis, autoimmune liver disease, metabolic causes, venous obstruction and biliary causes. ठीक है, so viral hepatitis, autoimmune disease, metabolic causes, venous obstruction and biliary causes. Biliary like biliary atresia, choledochal cyst, cholangitis, like all those things, right? I hope you are getting some points. कुछ दिमाग के तार को थोड़ा हिलाइए और इसको समझने की कोशिश कीजिए. Coming to Wilson per se. Now PG entrance question number 1. What is the inheritance? What is the inheritance of Wilson disease? Is this a autosomal dominant, autosomal recessive, multifactorial inheritance, X-linked dominant, X-linked recessive? What do you think? Now this you have to answer. This is a straight away exam question. Anyone? What do you think? Exactly. Shagufta Parveen from Allahabad is very nice. Very nice. She's answering yes. It's nothing but autosomal recessive. I will take a separate class, okay? I want to take a separate class of what is the meaning of autosomal dominant, what is the meaning of autosomal recessive, how the whole channel, goes and how many are affected. मैं पक्का उसके class लूँगा, मुझे याद दिला देना एक बार. So autosomal, it's a Wilson disease is an autosomal recessive inheritance. Basically जिसमें होता क्या है? We have an unaffected carrier father, unaffected carrier mother. Okay, once you make this connection, now what will happen, like in 1 in 4 means around roughly 25%, or 1 in 4 will be an affected child. It will be like unaffected, are you understanding? If there's an unaffected carrier father and unaffected carrier mother, then 1 in 4 babies will be affected. But detail I will tell you later, because there's a separate class of explaining what is autosomal dominant, how the chart is formed, what is autosomal recessive, how the chart is formed. At least this much we need to understand, that Wilson disease is autosomal recessive in inheritance. Number 1. PG entrance question number 2, which is the major cause of chronic liver disease. जो हमने इतने सारे causes पढ़े, so many causes we studied, right? Which is the major cause of chronic liver disease? Yes, exactly, very true. Yes, the major cause of chronic liver disease is nothing but our Wilson disease. In Indian children, 25% of patient causes of chronic liver disease will be Wilson. Wilson disease is one of the major metabolic cause of the chronic liver disease. Yes, very true. ऑस्कर मुझे याद दिला देगा. गुंजन इज वेरी राइट. पेडिग्री चार्ट समझाना है आपको, बहुत इजी है, कोई प्रॉब्लम नहीं है. दिस इज द हस्बैंड, दिस इज द वाइफ, दे हैड वन चाइल्ड. अच्छा, इसका एक क्लास लेंगे, है ना? इसका एक क्लास लेंगे, बड़ा अच्छा है, तुम्हें बड़ा मजा आता है करने में. फर्स्ट डिग्री, सेकंड डिग्री, थर्ड डिग्री जनरेशन पेडिग्री चार्ट, इट्स वेरी इजी, यू माइट बी नोइंग. मुझे याद दिला देना करके, बस मैं बता दूंगा. नेक्स्ट वेरी इंपॉर्टेंट, या दिस इज द गुड क्वेश्चन. पीजी एंट्रेंस क्वेश्चन नंबर 3. विल्सन डिजीज, इट वॉज अ IAP क्वेश्चन. एक्चुअली IAP क्विज हुआ था, इंडियन अकेडमी ऑफ पीडियाट्रिक्स, उसमें पूछा था ये कि विल्सन डिजीज इज डिस्कवर्ड बाय होम. किसने डिस्कवर किया था विल्सन डिजीज? एनीवन? आई थिंक पैनकेक अगर होती यहाँ पे तो पक्का आंसर करती है. व्हाट डू यू थिंक? हृदय ब्रो, उमेश, जूली, गुंजन, एंड देन वी हैव एनीवन, उमेश, विश्वकर्मा, ओसामा. विल्सन डिजीज was discovered by anyone? Wilson disease was discovered by Samuel Alexander Kenner Wilson. The name you should know, Samuel Alexander Kenner Wilson. This was asked in IAP quiz कि Wilson disease, Wilson जो बंदा है उसका पूरा नाम क्या था? It was Wilson itself. Of course, Shagufta is right. Samuel Alexander Kenner Wilson. That you should know. Next. Okay, this is a very, very basic question. I think every one of us might be knowing. What is the gene mutation? What is the gene mutation in Wilson disease? See, now how much we understood. In Wilson, number one, autosomal recessive. Number two, very important, what is the gene mutation? I think everyone knows ATP7B gene mutation, right? We have two types of gene mutation. We have ATP7A and ATP7B. So ATP7A, anyone? ATP7A is which gene mutation, anyone? Yes, ATP7A disease is Menkes disease, right? Menkes disease. And ATP7B gene mutation is विल्सन डिजीज वेरी, ये बहुत पुराना 25 बार ये क्वेश्चन आ चुका है. ओके, ATP7B जीन म्यूटेशन इज विल्सन एंड ATP7A जीन म्यूटेशन इज मेंके डिजीज. बट ऑन विच क्रोमोसोम, कैन एनीवन टेल मी ऑन विच क्रोमोसोम वी हैव दिस विल्सन डिजीज? कौन से क्रोमोसोम पे इफेक्ट करता है? अगर वो कोई बता दे सो मेरी तरफ से क्या, मैं गर्म पानी की बोतल दे दूंगा तुमको. बताओ एनीवन? प्रिया, ओसामा, शगुफ्ता, जूली, प्रिया. Yes, very good. The mutation is there in ATP7B, but the gene responsible is 13q14. This is again important. बहुत कम लोग ये जवाब दे पाते हैं. Star mark. It's a PG question. Yes, chromosome 13 is involved, and Q, chromosome Q. Q is what? The short arm or the long arm? Q is the long arm. Again, I have to link and study Cry-do-Chart syndrome. In Cry-do-Chart syndrome, which gene deletion is there? Anyone? In Cry-do-Chart syndrome, which gene deletion is there? Who will tell me? Anyone? 1, 2, 3, 4, 5 gene. Which gene deletion is there in the Cry-do-Chart syndrome? Anyone? That Cry-do-Chart के points क्या होते हैं? Microcephaly, high pitch cry resembling like a cat, high pitch cry resembling like a cat, and most importantly developmental delay. Yes, exactly. 5P gene deletion of 5P gene is affected there in our body. Yes, very true, Julie, Priya. So in Cry-do-Chart syndrome, 5P is affected. In in Wilson disease, 13q chromosome is affected. That you should know. And 5P chromosome is affected in our Cry-do-Chart syndrome. Yes, P. So P is the short arm and Q is the long arm. Okay, very good. So now listen very carefully. So everyone knows. See, imagine I am a 10th class student and you are a 7th class student. So what happens? What are we studying? Wilson. Wilson disease. What happened in Wilson? I tell you, copper. Basically, there's a problem with the copper. ATP7B gene mutation means what does normally ATP7B gene does? It helps in biliary copper excretion. ATP7B gene helps in the biliary copper excretion normally. Okay, helps in biliary copper excretion. So means defective gene means decrease biliary copper excretion, yes or no? And copper accumulation. Is this line true or is this line false? When there is a defective gene in the ATP7B, that means there is a decrease biliary copper excretion. Copper will not be able to get excreted properly and there will be copper accumulation. So copper everywhere. Copper everywhere. Yes, very good Julie, so beautiful, you're answering, very nice dear, and thank you for the appreciation. So समझ में आ रहा नहीं आ रहा? What are we studying? Wilson disease. Where is the problem? Copper. Sir, copper का problem है. क्या copper का problem है? Sir, ATP7B gene helps in copper excretion. So when gene is mutated or gene is defective, copper is not able to get excreted, or copper you can say is kind of accumulated everywhere. So serum copper increases, hepatic copper content, what you call it, increases. Everything increases, but only one thing decreases. What decreases? Serum ceruloplasmin level. Serum ceruloplasmin levels, basically they decreases. Serum ceruloplasmin level decreases, but hepatic copper, serum copper, urinary copper, every copper increases. सब excrete होता है, deposit भी हो रहा है, excrete भी हो रहा है, but serum ceruloplasmin levels basically it decreases. Why sir? Sir, ऐसा क्यों होता है sir? Why serum ceruloplasmin level decreases sir? Because see, when there is a defective copper, right, defective gene basically, so there is inadequate there is inadequate incorporation of copper into एपोसेरुलोप्लाज्मिन. लाइक इन इफ अ सिंपल शब्दों में अगर मैं बताऊं, कॉपर जो है वो एपोसेरुलोप्लाज्मिन में कन्वर्ट नहीं हो पाता. कॉपर इज नॉट एबल टू गेट कन्वर्टेड इनटू एपोसेरुलोप्लाज्मिन, और यू कैन से सीरम सेरुलोप्लाज्मिन. ओके, सीरम सेरुलोप्लाज्मिन. I'll repeat again. I'll repeat again. Normally, copper gets converted into apoceruloplasmin. Now there is Wilson disease. Nothing but copper. The defect is there. Defect. ATP gene mutation is there. So copper is not able to get converted into apoceruloplasmin or serum ceruloplasmin. So naturally, so copper will increase. Yes or no? And serum ceruloplasmin will decrease. If you say apoceruloplasmin or serum ceruloplasmin, these level decreases because there is a gene defect. Because because there is a gene defect, ATP gene defect, copper is not able to get converted into apoceruloplasmin or serum ceruloplasmin. Has everyone understood this much? Please put a like button or say yes or no. समझ में आ रहा है इतना? Say yes or yes. Thank you. So we have a subscriber by name Laude. Loud. He says, beautiful teaching, sir. Like it already. Thank you, sir. Very nice of you. हाँ जी, आगे बढ़ते हैं. Let's move further. So now we can appreciate that there will be decrease serum ceruloplasmin levels, right? Because copper is not able to get excreted into copper is not able to get converted into serum ceruloplasmin. That's why, right? Next important point. So naturally, copper everywhere. Copper everywhere. So there will be serum copper increases. Copper in my livers, copper in my eyes, copper is in my cornea, copper is in my CNS, copper is everywhere. Remember, okay, copper is very dangerous and copper is everywhere. So understood, this much we understood, right? Now clinical features, very easy. So what are the clinical features? So anyone? Okay, you only tell. I will not tell. What are the clinical features? If it, see, again, I am a Lord Buddha. Okay, I am a Lord Buddha. I am inside the Wilson. So copper is everywhere. Everywhere is copper. Everywhere is copper. So what are the features? What are the clinical features? Who will tell me? Who can help me in explaining the features? Anyone? Hriday, Priya, Loud, Shagufta, Osama, anyone? How has the clinical feature patient will present? Will the patient have hepatitis? Yes or no? Will the patient have hepatomegaly? Yes or no? Will the patient have any signs of liver failure? Yes or no? Yes, right? Yes, exactly. See, my HOD always used to say, whenever you're explaining something, go system wise. So clinical features. If liver will involved, what will be the features? If my kidney is involved, what will be the features? If my CNS is involved, what is my feature? If any psychiatric manifestation is there, then what will be the feature? Are you understanding? कॉपर एवरीवेयर, इट्स वेरी इजी टॉपिक ना. कॉपर इज एवरीवेयर, दबा के सारे फीचर बताओ, जो मन करे बोलो. यू से मेनिंजाइटिस, एनकेफेलाइटिस, आई एग्री. यू से हेपेटाइटिस, हेपेटोमेगाली, लीवर फेलियर, पोर्टल हाइपरटेंशन, वट एवर यू से, copper everywhere will create a problem. It is as simple as that. There is nothing to cram in this. Understood? Exactly. So that's what copper. So number one, the patient will have hepatomegaly? Yes, the patient will have hepatomegaly because copper is accumulated in my liver, right? Leading to hepatomegaly with or without splenomegaly. Copper everywhere. That's all we have to remember. Second, will the patient can have hepatitis? Yes, sir. Could be chronic, could be subacute. Patient definitely will have hepatitis. And please don't cram these lines. ये रटना नहीं है, कोई रटने वाली बात नहीं है. It's not a NEET PG question. In general, you know, if copper is there in my liver, number one, it will lead to hepatomegaly with or without splenomegaly. Can it lead to hepatitis? Definitely. Can it lead to liver failure? Of course. Dabake. Can it lead to portal hypertension? Because so portal vein, who will tell me? Portal vein is formed by anatomy question. Who's the topper in anatomy? Portal vein is formed by what? Who will tell me? Anatomy? Very good. So portal vein is formed by anyone? Yes. Superior mesenteric vein and splenic vein. Yes or no? नाम सुना है आपने गलती से? This is my splenic vein. This is my superior mesenteric vein. Very good. So superior mesenteric vein and splenic vein forms the portal vein. So that can lead to portal hypertension. Osama Sheikh is so right. Superior mesenteric vein and splenic vein at the neck of. Okay, very good. Perfect. So that's what. So portal hypertension, patient can have, definitely can have ascites, any variceal bleeding also patient can have, and delayed puberty or amenorrhea. These are, again, don't cram this, my dear friend, nothing to cram. Copper in my liver causing all those problems: hepatomegaly, hepatitis, failure, hypertension, portal hypertension basically, ascites, variceal bleeding, and any problem like delayed puberty and amenorrhea. Number one. Number two, yes, the patient can also have hematological problem like hemolytic anemias or coagulation defect in general. Okay, coagulation defects. Okay, very important question. So I'll give you a chocolate if anyone can tell me what do you see in this picture. Let me just mute it. Hanji, anyone, what is the picture? What can we see in this patient? Anyone, what do you think? What do you think? Yes, so what is this picture? Anyone, what can you see in this one? Kaun batayega? Yes, what do you call this? Again, it's a very important clinical based question. When he told to take the pen, the patient is having like this. It could be a very important clinical based question. What is this? Anyone? Tremors. Okay, fine. थोड़ा सा और refined word of tremors. Anyone? Seizures नहीं. I'm happy you're trying, but seizures नहीं है. But anything tremors तो हैं. क्या बोलते हैं इसको? कुछ नाम है. Focal seizures, no. This is known as intention tremors. This is known as intent. Once he take the pen, then he is having this kind of tremors. Very important clinical video based question. What is this? अगर if you are MBBS student, अगर ये exam में लिख कर आ गए intention tremors is seen in Wilson, then full marks. Okay, so this is nothing but intention tremors. This is nothing but intention tremors. So copper was in my liver, it had a lot of problems happened. Then copper is in my CNS, leading to intention tremor. Intention tremors बहुत important है, that you should know. Then other things, what can patient have? Patient can have dysarthria. बस CNS का जो मन करे बोलो. What is dysarthria? Anyone? मैं नहीं बताऊंगा. What is dysarthria? हृदय. What is dysarthria? गुंजन, सोनाली, शगुफ्ता, ओसामा, मणि प्रकाश. Dysarthria का मतलब क्या होता है? Is it a difficult in articulation of speech? What is dysarthria? Yes. मैंने बता ही दिया अच्छा आंसर. डिफेक्ट इन आर्टिकुलेशन ऑफ स्पीच. बोल नहीं पाता पेशेंट, बोल नहीं पाता. ठीक है, सो दैट्स व्हाट द पेशेंट विल हैव. डिसआर्टिकुलेशन ऑफ स्पीच. द पेशेंट विल हैव dystonia, nothing but muscle tone, abnormal muscle tone. Could be, patient can have a spasm and chorioethetoid movements. What should I give you? I'll give you my hanky. If you can tell me chorioethetoid movements, where else you see this this clumsy unpurposeful or semi-purposeful movements. Yes, exactly. Gunjan says, I think I also have in front of senior. That's very true, bro. That's like every one of us have in front of our seniors, like a intention tremors. Very true. So हाँ जी, chorioethetoid movements भगवान के लिए गलती से कहीं और कहीं हमने पढ़ा है या बस एक ही इसी में ही पढ़ा है बस के विल्सन डिजीज विल हैव अ chorioethetoid movements. Chorioethetoid means like a abnormal semi-purposeful movement disorders, right? Exactly. Yeah, you can say Sydenham's chorea also had some chorioethetoid movement like a milkmaid grip. Yes or no? Remember, भैंस का दूध निकालते हैं, milkmaid grip. So chorioethetoid movement can happen there also, and chorioethetoid movements are happening here also in Wilson disease. Okay, and also again lack of motor coordination, deterioration in school performance. Please, now this is a star mark. This was the MCQ. A 5-year-old child having delayed school performance or having a bad school performance and behavioral changes. Now this was the PG question. Okay, remember that. Like patient of Wilson, when the copper is there in my CNS, it will cause intention tremors, it will cause dysarthria, dystonia, chorioethetoid movements and all. But yes, there will be delay in the school performance. Examiner wants to make the question very realistic, very clinical. A 5-year-old child, mother gives her history, he's not good in the class, he's having delayed deterioration in the school performance. He was very good, but now he's deteriorating. Are you understanding? So that basically happens in our this also, what you called this Wilson disease. Okay, yes, Hriday is right. The Jones, Jones criteria, modified Jones criteria of rheumatic major and minor. In that one, we had the Sydenham's chorea, which is a late manifestation. Okay, very good. Psychiatric patient, psychiatric problem, what the patient can have. Anyone? मैं नहीं बताऊंगा. You tell. What are the psychiatric problems? It's an oral test. It's a general test. Copper. Okay, I'm inside the copper. Copper was in my liver. So everything. Portal hypertension, varices, hepatomegaly, failure, everything happened. Now liver, copper is in my CNS. These problems. Now copper is in my psychiatric evaluation. Psychiatric wise patient को क्या होगा? With the patient will have depression. The patient will have personality changes, anxiety, and psychosis. Very important. A patient, a 5-year-old child who was having delayed school performance or a decrease in school performance, he also had depression and personality changes. Teacher gives a history कि इसका personality change हो गया है. So that's how the MCQ is there. That's why I'm stressing on this point. Okay. Yes, very good, very good. Deepthi is right, Osama is right, very good. And that's right. And kidney, if it is affected, then of course kidney, the patient can go to RTA, renal tubular acidosis. In general, you should know, don't cram it generally, that's it. In kidneys, if it, the copper goes, the patient can go into Fanconi syndrome or renal tubular acidosis. And heart, it can lead to cardiomyopathy, and in the hormones, it can lead to any endocrinopathies. But there is no PG question here, so I'm just in general telling like why I wanted all this to say, because copper, my HOD used to say, go system wise. Copper in the liver, copper in the CNS, copper in my psychiatric problems, copper in my kidney, copper in my heart, and copper in my hormones. Copper everywhere is what is the thought process behind these slides. Okay, next, very important. Yes, now this is a very, can anyone tell me why this picture? If this picture comes in exams, only this picture, what are we trying to appreciate? What are we trying to appreciate in this picture? Can anyone tell me? Very easy question, very easy question. Anyone? Osama, Deepthi, Sonali, Julie, Priya. So sir, you are showing the various layers of cornea, and in the descent membrane of cornea, in the descent membrane of the cornea, what is there? There is deposition of the copper. There is a deposition of the copper in the descent membrane of cornea. And what is that thing known as? That is known as KF ring. Very good. The best picture, I think, once again, I would like to show you this. Now this is a very beautiful picture. This one, this, what is this? In the periphery, in the descent membrane of cornea, even this also, can we appreciate this picture jo arrow mein hai? It's a very beautiful picture of KF ring. Nothing but there is a copper deposition in the descent membrane of cornea known as Kayser-Fleischer ring. Everyone knows about it. It's a very common image based question, and it could be a 3 marks MBBS question. A 3 marks MBBS question. Comment on the KF ring. What is KF ring? Number 1, it is Kayser-Fleischer ring. Number 1. Number 2, everyone knows it's a brown discoloration. It's a brown discoloration at the outer margin. At the outer margin of the cornea. Naturally, why? Because of the deposition of copper. Are you understanding? I want to have an oral discussion on this. Don't cram line by line. What is this? KF ring. Simple. What is KF ring? Kayser-Fleischer ring. होता क्या है? Sir, copper का deposition होता है, बात होती है खत्म. Right? Copper deposition. That's all I want you to remember. अच्छा, very good question I had. We had a patient. Last month we had a patient of Wilson actually, और हमने उसका टेस्ट कराया था. KF ring आई थी उसमें. अच्छा, ये बताओ, how do you detect KF ring? कैसे? ऑफ्था के पास लेके जाएंगे, ऐसे देख लेगा, ऐसे करके देख लेगा. How do you detect the KF ring? By which? By indirect ophthalmoscope, direct ophthalmoscope. What is the how? Are you understanding my question? Yes, exactly. Yes, exactly. So Hriday Trivedi is right. Usually we see it by the slit lamp examination. Slit lamp. क्या होता है? What is slit lamp examination? मैंने तो कभी देखा ही नहीं. कैसा होता है? What is slit lamp examination? Who will tell me? Slit lamp examination कैसा दिखता है? कहीं रख कुछ कभी तुमने करवाया जीवन में अपना slit lamp examination? Who will tell me? Who will tell me? Anyone? So do you remember we used to go, अगर आंखें चेक करानी होती है, we put our chin. You remember something is there. The examiner sits on this side, the ophthalmologist, and the patient sits on the other side. And there's a machine where you put your chin like that. You have to put your forehead and put your chin like that. And one eye they focus like that, then another eye they focus like that, and you see some dot. एक सड़क होती है, सामने एक पैराशूट होता है. सबको याद है कि नहीं याद है? किसी ने करवाया? एक ना ऐसे सड़क होती है, रोड like that, okay, and like this, like this, like this, and there is a parachute. Does anyone remember this picture? Yes or no? किसी ने कभी करवाया है? Because I have got LASIK done, तो मैंने तो slit lamp examination कराया. Please raise your hands. How many of you have done slit lamp examination? How many of you have got slit lamp? Anyone? Osama Sheikh, very good. Shagufta, yes, याद है कि नहीं याद है? यस एग्जैक्टली, है ना. हाँ, हाउस, जैसे तुम्हारे इसमें हाउस होता था, मेरे इसमें वो होता है, क्या बोलते हैं, एक पैराशूट था. एक ऐसे ऐसे रास्ता, बड़ा सुंदर, वेरी ब्यूटीफुल पिक्चर इट वाज. इट इज अ रोड एंड वन डॉट 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 लाइक क्रॉस एंड वेरी क्यूट parachute is there. We need to focus that parachute. Do you remember that? Yes, exactly. Yes. Dhananjay says, is LASIK safe? Number one, yes bro, LASIK is very safe. आप मेरी आंखें देख सकते हैं, मुझे सब दिखता है अच्छे से. I don't have specs now and I'm really happy. After I finished my MBBS, I got LASIK done. The ideal candidate for LASIK is, number one, your power should be constant. Your power should be constant. If your power is deteriorating or aggravating or like increasing or decreasing, then you should not get LASIK done. And LASIK is rough, like mostly it is done once in lifetime. LASIK is done once in lifetime. In a way you can say, वो करते क्या LASIK में? They do cornea का thickness कम करते हैं. They reduce the thickness of the cornea so that the light exactly fall on that point where I can see the vision. So they reduce the thickness of the cornea. मतलब मेरा कुछ पता नहीं कितने mm था, तो फिर 122 mm से फिर 94 mm, ऐसा कुछ corneal thickness कम होती है basically. My ophthalmologist said that even you can get LASIK again also, but it depends from cornea to cornea. If you have a good size thickness cornea, then you can get the LASIK done second time also if your power has come again. Otherwise, mostly it is done once in lifetime. That you should know. Exactly. Okay, समझ में आ गई. Let's move further. This is the KF ring, very important. And slit lamp. Yes, ये exam question है dear, that how do you diagnose and this. So and Hriday has this one. Hriday वो बोल रहा था कि ऐसे ही देख लेते हो या वैसे slit lamp में. Okay, Hriday is asking, can you see directly or slit lamp finding only? See, frankly speaking, the slit lamp is required for a secure detection. I remember my ophtha friend only telling me, like, he was having a torch. This is the torch. This is the torch. Okay. So patient was sitting like this and he was putting a torch and he was telling, side say laterally he was putting a torch and he was telling me, Anand, there is a slit lamp examination. There is a KF ring. Anand, see, there is a KF ring. He just put a torch like that. And I was like, bro, I am not able to see, like torch side से डाला और KF ring दिख गया. मेरा ऑफ्था फ्रेंड ने बोला था कि ऐसे दिख जाता है करके. But I think the best detection is slit lamp examination. And also that's what if I have a KF ring, so very important, this is a very important exam question. KF ring indicates long-standing disease common with neurological manifestation. If I have a KF ring, I will definitely have some problem in my school performance, some problem with my handwriting, or some problem with my behavior. Are you understanding? Yes or no? If I have a KF ring, there are 96% chances that पक्का मेरा स्कूल में मैडम ने पक्का कंप्लेंट करी होगी. I will have some neurological problem. ठीक है? Is everyone understanding this much? Yes or no, buddy? Yes or no? सोनाली पेट्रा, गुंजन, समझ में आ रहा है? हाँ, मेरा माइनस नंबर था. Is everyone understanding? Yes or no? Please put a like button if you are able to understand first of all. That's it. And also, yes, what type of tremors do you see in Wilson disease? Anyone? What type of tremors do you see in Wilson? If this question comes, what will you answer? Shagufta, Priya, Dhananjay, Hriday, Osama, Sonali, what kind of tremors do you see in Wilson disease? You can say intention tremors, of course, the photo which I showed you, and also it is known as wing beating tremors. Very, very important. This also very important exam question. Wing beating tremor, wing beating tremors. Okay, that also you should know. Type of tremors you see in Wilson, intention tremors, of course, and it is also known as, this one more word known as wing beating tremors. I remember I had seen a video. The patient was told to do like this. Okay, when the patient was told to do like this, he was doing like, he was not able to do it. Once he do like this, he is having something and like that. So like a wing beating tremors or kind of an intention tremor, that you should know. And again, on between, yes, the Gunjan says class is still when. So dear, 10 more minutes, then this class is over. 10 minute or class karni hai humne, and I want to finish this topic here only because Wilson is 1 hour topic. That's it. We will not continue more than that. So 10 more minutes, then this class is over. We have this beautiful quote, motivating quote. See, this is nice. I like it. Please read. Very importantly, yes, sometimes the bad things that happen in our lives put us directly on the path to the best things that will ever happen to us. Can we see that this quote? Yes or no? Sometimes the bad things that happen in our lives put us directly on the path to the best things that will ever happen to us. Do you agree with this line? Yes or no? Anyone? Do you agree with this, Kartika? Pristine Ganja, Gunjan, है ना? Can you see that? Exactly, very true. So yeah, asterexis is different, bro. Ganja, asterexis is this. Okay, bro, listen. What is asterexis? Asterexis is, please put your hand like this. Then please put your hand like that. Now this one. See this. This is known as flapping tremors. Normally, if I'm putting my hand like this, I can do it very well. I can do it. This is normal. But if I'm doing like this, can you see that? This is nothing but very importantly, flapping tremors seen in what do you call them? Acute liver failure. Okay, that you should know. Okay, sometimes the bad things that happen in our lives put us directly on the path to the best things that will ever happen to us. And a small joke, Ganja says the best thing ever happened to me was when I was born with hair. Very good. So now you don't have hairs. Okay, no problem. It's okay. You can get cosmetic correction done, bro, if you want. That's it. So how do you diagnose Wilson disease? Again, a very important, I think let's finish this topic. PG entrance question number 10, which is the gold standard investigation of choice for Wilson disease. क्या लिख कर आएंगे आप? Which is the gold standard investigation of choice for Wilson disease? It's a straight away question for exam, anyone? So what we'll do, liver biopsy. Very good. Liver biopsy is the gold standard investigation of choice. I have one more question. Which is the gold standard investigation of choice of enteric fever? Which is the gold standard investigation of choice of enteric fever, and which is the gold standard investigation of choice of neonatal sepsis? Anyone? 3 questions, 3 answers. What do you think? Anyone? The gold standard investigation of choice of enteric fever is nothing but blood culture. Blood culture and sensitivity is the gold standard investigation of choice for enteric fever. For neonatal sepsis, the blood the for the what do you call it? The gold standard investigation of choice of neonatal sepsis also is blood culture. No dear, not septic screening, blood culture. Septic screening कराते हैं जूली, लेकिन gold standard, ये exam question है, gold standard investigation of choice will be blood culture. And the most commonest cause of neonatal sepsis in India is Acinetobacter, followed by Klebsiella. That also you must be knowing. Done. Finished. That's it. So how do you diagnose? So any two things can happen. Either there should be a low ceruloplasmin or a high urinary copper or KF ring. Any two of the following. So where number one, KF, ऊपर से नीचे KF ring, then low ceruloplasmin and high urinary copper. And of course, gold standard investigation of choice is nothing but hepatic copper content. You do a liver biopsy. क्या देखते हो liver biopsy में? Hepatic copper content, how much copper is there in my liver. Okay, and that's what decrease I told you, right? There will be a decrease ceruloplasmin. So the cutoff, very important star mark PG question, what is the cutoff of ceruloplasmin levels? The answer is less than 20 mg per dl. Can anyone wants to give it a try? Hriday, what is the normal ceruloplasmin level? Hriday, what do you think? कोई तुक्का मारना चाहेगा गलती से भगवान का नाम लेके? So what do you think? Osama, what is the normal ceruloplasmin levels. Normal ceruloplasmin levels. Anyone? Yes, the normal ceruloplasmin is 20 to 35. 20 to 35 is the normal ceruloplasmin level, and naturally in Wilson there is decreased ceruloplasmin level. And also I told you serum copper increases, urinary copper increases. So 24 hours urinary copper excretion should be more than how much? So any idea? Hriday, Shagufta, Deepti, पता है ना serum copper increases, urinary copper increases more than to what? That 24 hours urinary copper should be more than 1000 microgram per day. The 24 hours urinary copper should be 1000 microgram per day, and that's what, yeah, exactly, you can say that. And normal is less than 40 microgram per dl. So less than 40 is normal, and it can go to more than 100 or even more than, yeah, 1000 also. More than 100 it can go up to more than 1000 also, but less than 40 is normal. Less than 40 is normal, that you should know. More than 100 or more than 1000, but less than 40 is normal. That is over. And what else? Yeah, one more question. What is the total fetal cardiac output? That finishes this topic. Now 2 more minutes, then this class is over. What is the total fetal cardiac output? Can anyone tell me what is the total fetal cardiac output? Now I want you to remember something known as 450, 350 and 250. Mnemonic. I want you to remember three things: 450, 250 and 350 and 250. The total cardiac the total fetal cardiac output is 450 ml per kg per minute. Star mark, it has already been an exam question. If anyone has done the recent 3-year question paper, this was the question. Julie, very good, is right. Osama, 450 bro, 450. So 350 क्या है? 350 ml per kg per minute is the newborn baby's total cardiac output. Please, can we appreciate this line? Yes or no? Total fetal cardiac output is 450 ml per kg per minute. Newborn's cardiac output is 350 ml per kg per minute. And what is 250? 250 is nothing but that gold standard investigation of choice of Wilson. What do you do? Liver biopsy. Liver biopsy में क्या देखते हो? What do you see? Hepatic copper content in my liver, right? Copper everywhere, right? So hepatic copper content. So more than 250 microgram per gram dry weight of liver of hepatic copper content is diagnostic of Wilson disease. Please remember, I'll repeat again: 450, 350, 250. 450 ml per kg per minute is total fetus cardiac output. 350 ml per kg per minute, बच्चा बड़ा हो गया, न्यूबॉर्न बन गया, तो 350 ml per kg per minute is newborn baby total cardiac output. और फिर उसके बाद क्या आता है? 250. Yes, 250 microgram per gram dry weight of liver में hepatic copper content, you will say it's a diagnostic choice of Wilson disease. Very good answering. So beautiful, you guys are answering. So that you should know. Okay. One more question. So now it's the ending of topic. Is it important to screen the family members? Very good question. You see, these all are next questions. And next May examiner will judge you general on a general knowledge. You don't have to score 5 out of 5. You have to just talk to the examiner. If I am the examiner, I'll be asking you in general, like it's a clinic, it's a thoughtful question, right? You diagnose a child of Wilson, family को screen कराना है कि कोई कराने की जरूरत नहीं है. Do you want to screen the family? Osama is very right. Yes, family members required screening. उनका कराएंगे हम serum ceruloplasmin level and urinary copper, both will get it done. Okay, if the results are abnormal, then definitely there also liver biopsy I will get it done. Are you understanding? So it's important, number one. And also genetic screening by either linkage analysis or DNA mutational analysis. So three things are there. Number one, screen the family members. If the test results are abnormal, liver biopsy has some problem, then genetic testing, basically DNA mutation analysis. Done. Very good. What's the treatment? Last one. Anyone? Treatment. Last 2 minutes, then this question is over. Osama, Shagufta, Priya, Hriday, bro. Hriday is answering very good. Julie, Hanji, anyone? What do you think? What's the treatment? क्या देते हैं? मुझे तो याद भी नहीं है. Do you give some chelating agents? Yes or no? कोई देते हैं कुछ chelating? Do we give something which binds with the copper and excrete the copper? Anyone? Which binds with the copper and excrete the copper? पढ़ के आया सैम एग्जाम के बाद. क्या हृदय, में समझा नहीं ब्रो, क्या बता रहे हो डियर? Yeah, SAM exam के बाद. Yeah, so SAM में also, so where else are you giving? So okay, I'll give you a topic if you can tell me. जिंक, नंबर वन, जिंक इज अ गुड चिलेटिंग एजेंट। ओके, जिंक का मुझे 3 जगह रोल बता दो, मान जाऊंगा मैं। एनीवन, कैन एनीवन टेल मी द रोल ऑफ जिंक इन 3 प्लेसेस? वन, तो जिंक रोल इज देयर इन विल्सन डिजीज, राइट? जिंक इज अ चिलेटर, इट टेक्स द, it binds with the copper and excrete the copper. Copper too much everywhere in my body, right? It needs to be eliminated, so zinc will come, take the copper and eliminate it. So zinc is a chilator. So zinc is used in Wilson disease, number one. Where else? Very good, very good. Zinc is used in diarrhea. What's the dose of zinc in diarrhea? What is the dose of zinc in diarrhea? Who will tell me? Fast. Yes, less than 6 months 10 mg, and more than 6 months 20 milligram, 20 mg once a day. For how many days? Zinc is given in diarrhea for how many days? 14 days, right? 14 days. Where else other than Wilson and diarrhea, where else you will give zinc? Sam baby also you can give zinc, right? Where else you will give zinc? Acrodermatitis enteropathica, entity also, the patient present with perioral and perivaginal rash. Zinc is a magical drug. In that case, zinc is a magical drug. And what is the gene mutation, Osama? What is the gene mutation in acrodermatitis enteropathica? Jaldi batao, fast. Shubham Chaudhary, Shagufta, Hriday, Osama. So beautiful. People who are answering, top class. You will definitely get a rank for sure. Very good. So, what is the gene, Hriday? What is the gene mutation in acrodermatitis enteropathica? So the answer is SLC39A4. SL339A4, not 3Q buddy, it is 39A4. SLC39A4 is the gene mutation in acrodermatitis enteropathica. And acrodermatitis enteropathica, टॉपिकल जिंक, मल्लम आती है, क्रीम आता है जिंक का, ठीक है? सिरप जिंक इज इन डायरिया, एंड व्हाट यू कॉल टॉपिकल जिंक, बेसिकली इट इज देयर इन एक्रोडर्मेटाइटिस एंटेरोपैथिका. डन. थक गया मैं. So that's what. So copper everywhere. No. So what will you do? You restrict my dietary copper content. Very nice. No, less than 1 milligram per day. Restrict my dietary copper to less than 1 milligram per day. Next, yeah, this is a PG question. PG entrance question number 12. Can I have shellfish? I love shellfish. Julie, please, I'm suffering from Wilson. Can I have shellfish, ma'am? Please. It's my birthday. No. I want shellfish. Anyone? Shellfish is allowed? Can I have shellfish? Can I have shellfish? बहुत अच्छी लगती है मुझे fish. अच्छा, कौन सी fish पसंद है तुम? Do you guys have fish? Yes or no? I would like to talk. I love talking. हाँ जी, मछली खाते हैं आप लोग? Yes or no? If yes, then कौन से प्रकार की मछली खाते हैं आप? Which machli you eat? Anyone? So Priya is a vegetarian. Priya doesn't eat fish. Fine. Subhash Chandra Verma also no fish. Okay, cute. Osama also no. कोई मछली नहीं खाता. No one takes any fish. Fish के पकोड़े आते हैं. Fish अच्छी होती है. कोई भी नहीं खाता. Julie, what about you? Okay. Barbers are not selfish. Okay, that's cute. So अच्छा हाँ, तो do you have has you guys eat fish or not? ओसामा खाता है तो fish नहीं खाता. Priya is the pure veggie. Okay, nice. Pure veggies we have in the town, in the open house. Very good. हाँ जी. Anyone जो मछली खाता हो, कोई गलती से मेरा फ्रेंड बन जाए कोई. प्रॉन्स खाती है, जूली खाती है हर काइंड ऑफ फिश. अच्छा जूली, कौन सी फिश अच्छी होती है? रोहू तो होती ही है ऑफ कोर्स, लाइक इन अ वे, लाइक मुझे ना वो वाली पसंद है. लाइक व्हेन आई गो टू ट्रिवेंड्रम टू टेक माय क्लासेस देयर, आई हैव दिस, एक सिंगल कांटे वाली आती है, ऐसी नहीं आती एक, लाइक सिंगल कांटा, लाइक दैट. ये तो मैंने लीफ बना दिया, लेकिन वैसा वाला एक सिंगल कांटे वाला फिश आता है, रोस्टेड वाला. उम्मा, वेरी नाइस, वेरी नाइस. ओके डन. सो कैन आई, आ रहा हूँ. Can I have shellfish? Can I have nuts or chocolates? It's my birthday. Can I have chocolate, please? I'm suffering from Wilson disease. Can I have chocolate? Julie, will you give me chocolate if I have Wilson? नट्स तो दे दो यार. नट्स तो हर कोई खा सकता है, ऐसे मत करो. एनीवन? जूली, गुंजन, ओसामा, शगुफ्ता, प्रिया, व्हाट डू यू थिंक? एंड गांजा, हृदय ब्रो, खाना नहीं कर सकते कि कर सकते हैं? ये कैन वी हैव दिस? यस और नो? यस, द आंसर इज नो. Avoid, that's an exam question, guys, remember, that's an exam question, remember, so you should know. Okay, so the answer for, एक सेकंड में इसको जरा बंद कर दूं. Yeah, so that's what. So कहाँ चला गया? Yes, the answer is avoid shellfish, avoid nuts, avoid chocolates, avoid copper utensils. Even copper utensils isn't even not allowed. Okay, that is, and you demineralize the water if copper content exceeds 0.1 mg per dl. If the copper content of the water exceeds 0.1 mg per liter, then demineralize the water. And also copper chelating agents, we all know that oral D-penicillamine, very important. Oral D-penicillamine, basically 1 gram per day in 2 divided doses before meal for adults and 20 mg per kg per day for children. 1 gram per day in 2 divided doses. Oral D-penicillamine is given for adults. For children, the dose of D-penicillamine is 20 mg per kg per day. And of course, we have one more, nothing but trientine or teta बोलते हैं उसको, nothing but हो गया मेरा, आ गया बस, आ गया 2 मिनट में. So triethylene tetramine dihydrochloride, teta, TETA, triethylene tetraamine dihydrochloride, ये सब क्या देते हैं? Generally treatment you should know. And of course, everyone knows about it. I have to go. My mom is calling. Panda sign. Panda sign on MRI. Again, an exam question. Panda. Panda. पांडा, ये पांडा, दिस वन. सो पांडा साइन, ये ठीक है. पांडा की नोज है, क्यूट सी सावन यहाँ होता तो मैं उसको पक्का बोलता. सो पांडा साइन इज सीन इन विल्सन डिजीज. ओके, दैट यू शुड नो. Wilson disease. And PG question was drug of choice. Drug of choice for Wilson disease, D-penicillamine, not zinc. D-penicillamine. Okay. And penicillamine is an entabolite of vitamin B6. ठीक है, हाँ जी हृदय, तो मम्मी बुला रहे हैं. ठीक है, so that you should know. And other chelating agents we have like ammonium tetrathiomolybdate. Other than zinc, we have another chelating agents, ammonium tetrathiomolybdate. That's it. That finishes the whole thing. Zinc is good actually because zinc is very sasta, low cost, good safety profile actually. You can use in pre-symptomatic patients also, and you can, the dose is important actually, 20 to 25 to 50 mg thrice a day. 25 to 50 mg of elemental zinc thrice a day for adults. For children it is 25 mg thrice a day. So same ही almost same ही dose actually, 25 mg thrice a day or 25 to 50 mg thrice a day. That's it, done. Thank you so much for the participation. So the key points are: the best screening test, PG entrance question number 1, the best screening test for Wilson disease is serum ceruloplasmin level, which is decreased. ये question है बहुत important. The best screening test for Wilson is serum ceruloplasmin level. The most specific screening test is urinary 24 hours copper, and the gold standard test is liver biopsy. So best screening test, ceruloplasmin. Specific, urinary copper. Gold standard, biopsy of the liver. And urinary copper, everyone knows, is more than 100 microgram, or you can go to 1000, more than 1000 also microgram per day. Normal is less than 40. मैंने बता चुका हूँ ये, that you should know. And questions, KF ring is seen in anyone? 2016 question, Maharashtra PG question, 2015 question. So KF ring is seen in Wilson disease. In Wilson disease, which of the following is seen? Anyone? In Wilson disease, West Bengal PG 2016 question. In Wilson disease, what do you call, which of the following is seen? Do you see low ceruloplasmin or high ceruloplasmin? Of course, low ceruloplasmin. But high urinary copper or low urinary copper? I think high urinary copper. So low ceruloplasmin and high urinary copper. Wilson disease is caused by, everyone knows, ATP7B gene mutation is Wilson. ATP7A gene mutation is Menkes disease. Done. And about Wilson disease, all are true except what is not true. What is not true? Is it a autosomal recessive? Hanji sir, it is very true. Do you see Kayser-Fleischer ring? Definitely. Raised copper content? Definitely. Raised ceruloplasmin level? No. There is decreased serum ceruloplasmin levels. Yeah. Trientine dose? No, dear, it's not zaruri to remember the dose. Which of the following is true about Wilson disease? AIMS November 2012 question. Which of the following is true? True. Low serum ceruloplasmin and high urinary copper. Is this line true? Hanji sir, I think that's better actually. There is low serum ceruloplasmin level and high urinary copper. The gene mutation of Wilson is on which chromosome? Who will tell me this? So my mom is calling. I'll go. The gene for which Wilson disease is on, which gene it is on, we know that, right? Long arm, Q, 13Q. Remember 13Q. 5p gene deletion was there in Cry-do-Chart syndrome. 5p chromosome deletion. And 13q was the one in Wilson. That you should know. Congenital Wilson disease is characterized by KF ring at birth, may present as acute hepatitis, decrease urinary copper excretion. Decrease तो हो नहीं सकता, decrease हो नहीं सकता. Okay, the best answer for this one is like KF ring are absent in young patients. KF rings are absent in young patient. Okay, so Wilson disease, Yeah, if I have a neurological problem, if I have a neurological problem, 95% chances are there I will have a KF ring. Yes or no? If I have a neurological problem, there are 95% chances connection. The KF ring and my CNS symptom are 95% are chances they'll be connecting together, right? So the congenital Wilson disease is characterized by acute hepatitis basically. Okay, this part is over. Okay, that's what. 12-year-old girl, 12-year-old girl with mood and emotional liability. देखो कितना इंपॉर्टेंट क्वेश्चन है, समझ में आ रहा है नहीं आ रहा? मूड लाइबिलिटी, इमोशनल प्रॉब्लम, हैज अ गोल्डन ब्राउन डिसकलरेशन ऑफ डेस्मंड मेम्ब्रेन. आई थिंक एनीवन कैन टेल दिस, इट्स अ विल्सन. ऐसे क्वेश्चन आएगा, प्लीज डियर. मूड प्रॉब्लम, 12-year-old गर्ल, मूड चेंजेस, स्कूल परफॉर्मेंसेस प्रॉब्लम, and something golden brown discoloration in the desmond membrane of cornea, Wilson disease. That's it. That finishes Wilson disease. Thank you so much for the participation. And before leaving, we have this quote amazing, which says, I am strong, I am kind, I am beautiful, I am smart, I am important, I am fearless, and I am amazing. So this is, tell yourself, I am strong, I am kind, I'm beautiful, I'm smart, I'm important, I'm fearless, and I'm amazing. Thank you so much for the participation, everyone. See you tomorrow morning, 9:30 a.m. 9:30 a.m. on the Unacademy app. On the Unacademy app, I have made a MCQ on 100 MCQs on TB and HIV. I'll be asking you questions on TB and HIV. 100 MCQs I'll be asking you tomorrow morning, 9:30 a.m. Test we have, and 1:30 p.m. tomorrow on this same YouTube channel we have this again, inborn errors of metabolism part 2. This was the part 1 of the inborn errors of metabolism, Wilson disease. Tomorrow I'll talk about Menkes disease, or maybe I'll talk about some disorders of carbohydrate metabolism or disorders of amino acid metabolism. Bye, take care, and like, share and subscribe. ठीक है, bye.